My name is Darwin, and I'm from Miami. I'm 38, going 39. So probably I started when I was 30 years old, and the last 2 years has been the worst. No, never had a procedure before. From the father's side, I see my dad
Okay.
is fully, completely bald.
Okay.
My family members are skeptical about the procedure. So it affects me. Just my profile has changed. I mean, the face has changed a little, and I just want to get that profile back and maybe a little bit of the confidence. The profile again, I want it back and probably more volume. So I just been searching, not that much, but lately I saw the reviews you got and I gave you a try, and I mean, so far everything has been perfect. I mean, no pressure whatsoever. I mean, they didn't even ask me to sign anything before I got here, so it looks, everything seems natural and the way that it should be. I probably researched for the last 3 months. We've just been researching it, and so the problem that I ran into was my hair type. I didn't see my hair type. It's not fully curly, but it's not straight. So that's my concern, that it's a different type of hair, you know. So let's see the results, and for them people out there that have my same hair type, we could show you the outcome. So let's be positive and we'll hope for the best.
So what we've done is we've drawn out the hairline here, and you can see that we're recreating a hairline that he used to have. You can see from the prior picture that we're gonna put in the video, this guy used to have a nice hairline back in the day. Not even that long ago. I would say maybe, what, 10 years ago? At least you had a hairline. Yeah, even though there was some changes perhaps of thinning, but at least you had the hairline. So you can see, I'm gonna put my hands right on the line that we drew, that he is gonna have a completely different look. So you can see how that squares off. I'm gonna turn your head a little bit to the side, right. So what you wanna have is you wanna have a temporal peak and you wanna have a space here. So what you want, and that basically is gonna be that masculine 90-degree angle. You can see that his whole profile is different. This is exactly where it's gonna be. Now we never do a straight line. It's always gonna be staggered up and down on that line. We're gonna be using micrographs. We always use micrographs in the frontal hairline. No more of this pluggy doll's hair looking stuff that some of the older style transplants you may have seen. So I'm really excited. We're gonna go back from the front. We're gonna build evenly across, and we're gonna bring it back until we run out of grafts. The ones behind the frontal hairline are gonna be the density grafts, which are gonna give us some meaningful density. With his hair type, we're expecting anywhere from about 30 to 40%, but probably closer to 40%, because he has some thick hair, so he is a great donor. We're hoping to get back to about here today and really focus on this front. We're going to try to go for as much hair as possible again. We'll get the 30 centimeters and we'll try to go for more, depending on his elasticity, of course. So we don't know until we get in there. But man, I'm super excited today, and I can't wait to see your results. Thank you for showing other people what the process is like, and I guarantee you people will identify with you.
Yeah.
And you're helping people out. So thank you so much. Dr. Huebner here, Natural Transplants, here with Darwin. So we just completed the anesthesia. Darwin, how was the anesthesia for you today?
No pain whatsoever. I mean, nothing. I don't feel anything.
Cool. Most people will say it's a little sting here and there, but it's certainly tolerable. Nothing to really be worried about. There's no reason this would cause somebody not to do the procedure based on the anesthesia. So
No.
Yeah. So awesome. Cool. Looking forward to getting some good results for you. Dr. Huebner here, Natural Transplants, here with our patient Darwin, the VIP of the day. Darwin, how's your day been going so far?
It's been pretty good. No pain, just relaxing.
Great. At this point through the procedure, we've taken this strip out from the back and sewed it all up. In Darwin's case, we were able to get an additional strip based on his great elasticity. His donor is amazing, so we're going to anticipate a great result here. I wanted to show people exactly what it looks like. Now, Darwin had his hair pretty short today, and even so, we were able to. It's completely hidden, as you can see here. So you know, no one's going to know what's going on. Now, obviously, he's going to have some scabs here on the top, which may be difficult to hide for the first couple of days. But he's able to take a couple of days off work. The scabs will fall off, and he'll have look normal again. So, but I wanted to show you what the incision looks like. So, thanks, Darwin, for. So this basically starts here in front of the ear and goes all the way around. Now it's hidden from the hair that he has. We're able to shave it in a way that The hair on top of it lies over top and hides your incision. But that's going to go all the way around. It's completely together. The size of the scar should literally be as wide. If you took a pen and drew a line, that's about the size of the scar he's going to have. It's going to be completely hidden with the hair he has. He'll be able to wear his hair pretty much however he wants. Even if he wants to wear it short, should never really be an issue for him. So very excited. What we're going to do next is we're going to put the tiny little slit-like holes in his, basically where the hairline's going to be. Those are going to be the 1 and 2 hair grafts, transitioning those into the larger density grafts that are going to go behind that. And we're going to keep going until we run out of grafts. Probably going to get back to about 2/3 of the way, maybe even more based on the fact that we got a 3rd strip. But Darwin, I'm very excited about the way things are going, and looking forward to showing you results of it. Dr. Huebner here, Natural Transplants. I'm here with Darwin. We're at the about 2/3 of the way through the procedure. The strip's been out. It's all sewn up in the back, and now we've already made all the little tiny sites where the grafts are going to go. Darwin, how's your day been going so far?
It's been pretty good. No pain, just comfortable.
Cool.
It's relaxing.
Cool. Yeah, we've been listening to music and singing along, and it's been a real nice, enjoyable day. So I want to come in here and show you what we've done. So basically we've recreated his hairline, and this is again all these micro grafts, 1 and 2 hairs, recreated that hairline in the front like he used to have, and then we transitioned those into some bigger grafts behind here. Now in Darwin's case, we were able to get him approximately 8,000 hairs. So that's going to get him back dense packed into his crown, so even further than the line that we drew. So we got him clear back to here, about 3/4 of the way back on his head. He's only going to have a little area in the crown that's not going to be addressed today. So it's way more hair than we thought or anticipated, and that's basically due to his elasticity, meaning that you can bring the edges back together no problem and get a little wider strip than 1 centimeter. In addition to his density, his donor is incredible. He has nice thicker hair in the back, and that's going to help him achieve density. Most likely around 40% is what we're estimating he's going to have. So we're very excited to see Darwin's progress. Darwin, I hope that this video can help some other people. Yeah. Would you have anything to say to anybody that's thinking about getting a transplant or worried about how the procedure is?
No, it's not a big deal. I mean, you just come in and relax and they do it. No pain, and we'll see the quality later on, but I'm sure it'll be fine.
Okay. Looking forward to your results. Thank you so much.